We start out with auricular acupuncture. This means ear acupuncture, and when we use the energy channels of Chinese medicine, traditional Chinese medicine, these are channels that are, for the most part, equal on everybody, every human being. They even have meridians mapped out for animals, but for most people, the areas that have the most concentrated meridians are in the ear, the tongue, the palm, and the foot. And that's why we go straight to the ear. Sometimes when you have somebody with back pain and some symptoms of discomfort, we try as much as possible to help the body heal up. And when it heals up, it usually gets rid of the pain. This is why it's important to evaluate somebody for pain, because sometimes you can have pain in the back area that's referred from a kidney stone or a shingles outbreak, or problems with the organs of the belly, pancreas, sometimes kidneys. So it is important to make sure that the patient's history jives with the physical exam. In this case, and that's what any traditional Chinese medicine doctor would do, usually they'll check your tongue and check your pulses and then check the color of your face in addition. I just went straight to the musculoskeletal or the bread and butter of traditional Chinese medicine or acupuncture, and that's going to be with localizing the discomfort and then trying to get the energy or the pain down. In Western medicine, we have things called TENS units that physical therapists will apply, and they're fantastic for reducing inflammation. A TENS unit is a transcutaneous electric nerve stimulator, and the TENS unit will apply gentle and continuous electricity or electric impulses to help the muscle relax. Is this the area of pain, Mummy?
No.
Here?
Yeah.
Okay. So sometimes with the use of a TENS unit, you'll have a little bit of electricity. Shouldn't be any painful. And it just essentially makes the muscle jump. Any more pain?
None.
What I want to do is to stimulate the meridians, but also, in addition to the traditional Chinese medicine, use the Western concept of electric stimulation to help relax muscle. So I can find 2 points that are painful or that are aching. Is that right?
Oop. Oop.
And we were able to hit our tender spots. And then we also try to get the meridian. So I'll use those points, the tender spots, and I'll try to get electricity to those areas. What better way to get electricity to those areas than with also stimulating a meridian in Chinese medicine, but using the application in Western medicine that we always use. At the UCLA, we have been taught to use electric stimulation with our needling. And I think it's a great combination. The idea is to improve, speed up the body's healing with doing no further harm. And I have a lot of people that are worried about using acupuncture because they don't like needles. Well, I'll show you a close-up later on with what a needle looks like in acupuncture and what a needle looks like in Western medicine blood testing. Totally different. So you might be thinking, why am I going down below the area of pain to stimulate the patient? And this is part of the meridian. Sometimes if the area is too tender, we'll go above and below the area, always stimulating the same meridian, and try to get some relief. Just like a football player that's iced his quad or his thigh because he just took a helmet. I can't do needles to the quad or the thigh that's been iced, so I'll go over to the other side. Or if I can't do that, I'll go to the back of the leg or another area where I can access the meridian. So, and it works fantastically. Some people who are very needle phobic, if I have a meridian in the front of the body or in the face, and they just won't tolerate, they get too anxious, I'll just go to a different part of the body where I can find the meridian that they won't be able to see or feel as much. And that's reasonable to stimulate that way too. Is that okay? Just take some slow, deep breaths. So now that I just put in 3 acupuncture needles, and then 1 additional one in the area of pain, and then 1 downstream, as we call it, downstream. So hopefully with a little bit of stimulation we can get in traditional Chinese medicine terms, we can get the energy flowing. But in Western terms, hopefully I can get the muscle to exhaust and relax. With muscle pain, usually, especially the back, it's usually because of muscle spasm. And muscles, the good thing about muscles is that when they spasm enough, they'll eventually relax because they run out of energy to contract. If I can get it to contract quickly with the speed of this electric stimulator, then I can get it after about 15 minutes. The muscle will actually either be numb, the skin will be numb, or the muscle will fatigue, and then you'll have relaxation for a short time. The other things that I do, or at least that I've been taught, are moxa. Moxa is mugwort. It's rolled weed, essentially. Not marijuana weed, but a weed leaf. And the burning of the leaf will provide a little bit of heat. There's supposedly, with any botanical, when you heat up the leaf, bark, or twig, or root, you'll have the essence of the plant released. In this case, I mean, the more practical sense is this is heat. We're going to use heat to relax muscle, that's common. But in another sense, you can use the plant essence to hopefully transfer the healing power of the plant into the patient that's suffering. There's a little bit of heat. Are you still feeling the electricity?
Yeah.
Okay, is it okay?
Mhm.
There's a little bit of heat also, nice and warm. You feel any warmth?
Mhm.
Is that good?
Yeah.
So usually the heat stimulates more input into the needle. And if we do it in the right order, first I apply it to the area that hurts the most for relief, or at least to make sure the patient understands what kind of soothing we're going for. And then we'll try to stimulate the needles in the direction of the meridian. Again, I like to talk in 2 different terms. The Eastern or traditional Chinese medicine way is to think of energy flowing in the body, and if energy flows, then we have a healthy body, no pain, no disease. The body gets itself healed up on its own. Inherently, the body can do that on its own if given the right building blocks of rest, movement, relaxation, and nutrition. When we kind of are imbalanced and don't do it in that order, or don't do any of that, then disease will manifest and DNA will show its bad side. And that's where the Western medicine concept comes in. When you have muscle pain, or at least back pain, I just think of it in musculoskeletal terms, we want the patient to stop suffering. So usually we'll do medicines first, physical therapy if the medicines don't work, total rest if that doesn't work, more medicines, and then finally surgery. That sometimes works, helps relieve discomfort, at least severe discomfort, but you'll see in the emergency room how some people are just in that cycle of not healing themselves up, continuing with the lack of balance in exercise, nutrition, rest, or relaxation, and the disease will never heal itself up. You'll be stuck on either surgeries or medicines, which I guess is okay for a short time, but I really don't think that that's the appropriate way to heal up. Plus, it adds to the total deficit of healthcare spending. So, both what I'm doing now is having the patient heal up with rest. I'm having a rest here. With traditional Chinese medicine, with techniques of Western medicine, and hopefully we'll get improvement. If we get improvement in mobility and functionality, then we can take advantage of physical therapy, and I've already called call a physical therapist to come in tomorrow and see her. How's your pain now?
God.
You feel it still?
No more.
You still feel the electricity?
Yeah, but the pain is gone, I think.
Okay.
I don't feel anything.
Just 10 more minutes. So that's enough for the moxa. There's a cool story out of UCLA. This moxa or mudwort smells or resembles the smell of marijuana and the marijuana leaf. So when me and about 600 other doctors at UCLA in about 10 years ago were practicing and learning, most of us in the conference area smelled like that when we went back upstairs. So with all of us smelling like that as we all got on the elevator, the people that were working in the hotel were looking at us because most of us also practice acupuncture on each other. Acupuncture has this way of making you feel very high or very happy because you release pain and you get energy moving. Well, we were going into this elevator, all smiles and giggles, smelling like marijuana, and you can imagine what the workers at the hotel were thinking. They all wanted to volunteer. The next day, I think they had a line of volunteers of hotel workers to be our acupuncture patients. But there is, if you've ever talked to anybody with acupuncture, whether it takes care of their main ailment or not, there is a release that you get, and I would say scientifically it's a serotonin release. Anytime anybody puts their hands on you for healing, you'll have a serotonin release. If you have intense concentrated healing for 15 to 20 minutes, hands-on, or in this fashion, you have no choice. You're going to feel good. And the question would be, how long do you feel good? And it won't interfere with your own Prozac, Zoloft, Paxil, Effexor, Cymbalta. It won't interfere with that. It'll just make you feel a little better. It'll make pain go down. Even if you still have the pain, it'll make your conception of the pain or your interpretation of pain easier to deal with. And if it is easier to deal with, you say get downstairs to eat, you go to the bathroom more readily, you move around and communicate, you get to do things that you normally would do in everyday life. Those are activities of daily living. So if we can get somebody back to activities of daily living, whether we take care of the true problem of muscle spasm or kidney disease or some other form of back problems, osteoporosis, osteopenia, disc disease, we've already gone one step in a positive direction instead of one step backwards. And that's when I feel, although medicines are great, physical therapy is great, chiropractic is great, sometimes if we don't allow the human to make the lifestyle change, they'll be stuck on those modalities forever. And I don't have a problem with doing acupuncture, but it's not covered by insurance. That tends to be, for my patient here, it's free of charge, but for most other people, that can be interruptive to your life. You can't work, it'll come out of your pocket, and you will feel good, but so you'll see that's a little bit different than deficit spending of healthcare. But again, if the bottom line is to get somebody healthier and working in community and doing what they're supposed to do, finding their purpose in life, then I will use any means possible to get them there. And that's why I love integrative medicine, so as I'm actually fellowship trained in sports medicine, so I can get to the best back people, the back physical therapists that I know, or I can do this and speed the whole thing up. So, how's your pain now?
I'm trying to feel nothing.
Don't feel anything?
Nothing.
Just a couple more minutes. For the last 5 minutes, I want to try to turn this up a little bit, okay?
Okay.
So I wanted to show you the difference between the needles. In traditional Chinese medicine or medical acupuncture, we use needles. I hate to call them needles because everybody gets a little anxious when they hear that word. And I wanted to show you why you don't have to be anxious. This here is an 18 gauge needle that's usually used to draw blood. And the idea of an 18 gauge needle is if you can get into the skin via the sharp edge of this thing. If you can get into the skin, you can get into the blood vessel, and anything that comes into the process of falling through this lumen will come out the other end into your vacutainer or your tube. You can also transmit blood or drugs this way into a blood vessel. So you can see it's kind of sharp. This is an acupuncture needle, specifically a small gauge acupuncture needle that's used in auricular acupuncture because it's so tiny. And I'm going to show you I can fit this. I'm not sure if you can see it.
and it's so small, I'm trying to see myself. I just fit it inside the 18 gauge needle. I'm going to try to fit another one. There's a larger one. This is a more standard needle that I use for acupuncture, and I fit that one in there too. So you see that and there's a little bit of wiggle room. Let's see if I can get the last one in. This is one of the bigger needles that we use for acupuncture. It's used in cases of low back where you have to go in deep muscle, and it's thick. So I'm going to try to fit this in here too, and look at that. So there's still wiggle room. I can fit 3 of my needles, even more of my acupuncture needles, smallest, medium size, and large, with a lot of wiggle room. I can fit that into an 18 gauge needle. So I can actually fit more. So you can see that these wires are very flexible. They're very flexible, and they are steel and they are sharp, but they don't cut like these guys do. So I'll have people who are sensitized to the idea of needles, and I understand that. But just remember, like in my video of the patient I just had, she at times she would jump when I would put the auricular in or the standard, but that's because she was in pain. And theoretically, the pain that she was suffering is the meridia that was blocked up. And she's now doing great. She was able to walk out, actually take a car trip just now, and she's doing fine. These are the channels of energy, or meridia, that I was talking about. You'll see that this model, acupuncture model, has them mapped out on his face, his neck, chest, go over to the arm. So there are predetermined meridias that go down all around the body. And the points that we have here are the same points that were used 2,500 years ago. You see the neck, scalp, even down to the back where my patient was suffering. So they have been used for centuries, millennia, 2,500 years ago, and they're still in use now. So that's the one beauty of traditional Chinese medicine, is that we have time to prove that it does work. In China, they actually have places that you can go to just for traditional Chinese medicine, as far as a hospital, or Western medicine, as far as standard treatment that we're used to. And then you have the option of going to either one you choose. And here we don't see any of the points on the ear, or the auricular points, but it's too fine. And as I mentioned, it's concentrated. Most of these meridias you'll find in the representative channels in the ear. It's just a beeline to stimulate the meridias if you want to go straight to the ear.
For people who come in to see me for disease management or even pain, just make it pain like the patient I had, the idea again is if there's a deficiency of energy or a spasm in her case, I want to get the energy moving. That's in medical acupuncture terms. But in the Western medicine or the sports medicine terms, you want to heat up the area so it's soothing and the muscles relax. That's what hopefully will get the spasm away. Even if there's a disc involved, or even if there's arthritis involved, even if it's from a kidney stone but it's so painful that the back is spasming, if you can relax the muscle, then it'll take away 50% of the pain. And then that's, well, unfortunately that's usually done with prescription medicines, but I think there are other ways to do it. Just the unfortunate problem is you have to be able to get to somebody who can do these things. So at UCLA I was taught to use moxa or mugwort. You burn this and you heat up the areas that are in pain or spasm, and it helps increase blood flow, relax muscle, and in old-fashioned terms it helps move energy. You can also use electricity. This is essentially the TENS unit, and I'll put a link to my previous talk on TENS units. And what we are taught at UCLA is this actually will help a meridia move energy faster than just leaving the needles in alone. You can certainly use moxa. You can use burn any herbs on top of each of the needles. You can twirl the needles.
So all those things you can actually apply Tui Na or hands-on massage, but all those things work to heat things up, move energy. So TENS is also a great way. It's what I was taught. I think this is superior if you're going to a medical acupuncturist. I think it's superior to move energy and get muscles to relax compared to just needles alone. This is a space blanket I received from a company that I bought my space heating sheets from. This is great because it does keep heat in. I use this more for hikes in case I run into anybody with hypothermia. But the beauty of the space blanket is that it's so light. Now these guys are usually given away at the end of the marathon or in the medical tents of the marathon, Chicago Marathon, for quick heating. You put this around a runner as they finish and break the tape at the end of 26.2 miles, and you'll usually be able to at least keep the heat in as they slow down their activity. In the use of acupuncture, I didn't film it, but I covered the patient up, and after I did the electricity, the moxa stimulation, a little bit of Tui Na, this kept the heat in. She was kidney deficient, in my opinion, and this will help. So she felt very soothed afterwards. She had no pain as she left the clinic, and she's doing great now. So hopefully she continues to improve. The objective, again, it's not going to be a turnaround 100%, I'm back to normal kind of thing, but it works to get the body to heal up. Any modality, whether it's yoga therapy, hands-on healing, like Tui Na, Thai massage, needling from medical acupuncture, any of these things are supposed to help the body heal up faster. Now, if you are in a predicament where years of abuse by bad nutrition, no activity, obesity, if you're into that kind of presentation, then the likelihood of applying all this stuff in addition to Western medicines, we'll probably find a respite or a time when you can get a whole bunch of things to help you get better, but it's really, if you don't do anything to make a major lifestyle change, you will be dependent on all of these things. Or somebody's going to, in the Western medicine sense, somebody's going to cut you one of these days, and sometimes it's necessary. If it's necessary to, say, do bariatric medicine for somebody who just can't stop eating and is morbidly obese with medical problems, then we do it. If somebody is suffering from gangrene and a crushed limb, then you got to take it off. If somebody's suffering and can't get back into normal activity in the community because of a disc problem and back pain, then you got to work on the disc. But again, you still have to feed that person, you still have to practice relaxation therapy, you still have to do some form of movement. So all these things are important, but if you don't change your lifestyle, then it's all for naught, because sooner or later you're going to, whatever things that we use or find success with, they will fail. So please don't just get into a false sense of security by saying, hey, now we got acupuncture, I'm going to just rely on that. Plus, the other thing with acupuncture is that it's not covered by insurance, as I mentioned before. So it does require you to invest, but if you also likewise invest in a lifestyle change, you'll hopefully not need any of us or any acupuncturists and do fine into your 80s or 90s with as little medicines and surgery as possible.